Uganda is set to receive 10,000 doses of monkeypox vaccine donations aimed at interrupting and stopping transmission in order to limit infections. According to the Ministry of Health, the vaccines are slated to arrive in the country in the month of February. This was addressed today by the Ministry of Health officials in a media briefing at the Uganda Media Center.
Uganda is expecting to receive the Mpox vaccines next week. This is as a result of the global efforts of prioritization of Mpox outbreak, whereby the vaccines have been fast-tracked to help countries to be able to stop the transmission.
According to Dr. Mary Boyd, the U.S. CDC director in Uganda, Uganda is among the top 3 countries affected with monkeypox, and the U.S. government has committed itself to donating 1 million Mpox doses to affected countries, Uganda being a beneficiary where 10,000 doses will be allocated.
Us as the U.S. government, we're focused on delivering on our commitment that's been made. Our administration has committed to and donated 1 million Mpox doses for affected countries. And this donation has been put into a pool of donations that come from other countries such as Canada, the EU, the Gavi, and Africa CDC. These doses have been put into a pool, and that this access and allocation mechanism decides which countries will receive them. And Uganda is, as has been said, will be receiving an allocation of 10,000 doses within the next few days.
Dr. Boyd states that the doses have been tested and gone through clinical trial, hence proven viable for use by different organizations. Testing kits are also meant to be provided.
It's important to state that these vaccines are safe. They have been rigorously tested through clinical trials over years, over thousands of individuals, and have been approved by the U.S. Food and Drug Administration, but also qualified and approved by the WHO, and has been administered to over 1 million doses of this vaccine have been administered to the people in the United States.
In a report by the Minister of Health, Dr. Ruth Aceng, there has been an increase in the cases across the country, where cases have been reported in 71 districts and 52 districts continue to report cases, however, with an exception of Adjumani.
The ministry provided a comprehensive update on the status of Mpox on the 6th of September 2024. The outbreak has continued to expand, with a cumulative total of 1,712 laboratory confirmed Mpox cases reported across the country. Encouragingly, 1,089 individuals have fully recovered and have been discharged from the various treatment facilities. Unfortunately, 10 lives have been lost, with the majority of these individuals having underlying medical conditions such as HIV/AIDS, malnutrition, diabetes, and sickle cell disease. As of today, 169 individuals are receiving care in designated isolation and treatment facilities.
She states that the outbreak is prevalent among mobile workers that increases infections. However, Dr. Aceng also mentioned some of the interventions that the ministry is carrying out to limit the spread of the infections.
The Ministry of Health is implementing the following measures to contain the outbreak. 1, enhanced surveillance, active case search, contact tracing, and strengthened laboratory diagnostics. 2 is public awareness campaigns, dissemination of information of Mpox prevention, symptoms, and early treatment through community health workers and media platforms. 3 is capacity building. We are training health workers in case management and proper use of personal protective equipment.
Despite the efforts to contain Mpox in the country, the public has also been urged to remain vigilant after a confirmation on the outbreak of Marburg in the neighboring Tanzania, especially in the districts of Greater Masaka that are proven to be hotspots. Hope Nyongereza, Church of Uganda Family TV, News at 8.